Hey everyone, welcome back to our channel. Before we jump into today's topic, I've got a quick question for you. Where are you tuning in from? Are you watching from the Big Apple, the Windy City, or maybe somewhere out in the wide open plains? Drop your location in the comments below. I can't wait to see where our community's at today. All right, let's dive into something super important. The gaps in Medicare coverage. Medicare is a cornerstone of American life for folks over 65 or those with certain disabilities. It's the safety net we rely on. A promise that Uncle Sam's got your back when medical bills start piling up. But here's the kicker. It doesn't cover everything. In fact, some of the things it leaves out might surprise you, and if you're not ready, they could hit you right where it hurts your wallet and your well-being. Today, we're peeling back the curtain on 10 things original Medicare parts A and B doesn't cover. This isn't just about listing gaps. It's about digging into what they mean for you, your family, and your future. Knowledge is power, and understanding these exclusions can help you plan smarter and live better. So, grab a coffee, settle in, and let's get to the bottom of what Medicare's missing. Number 1, vision care. Let's start with something we all take for granted until it starts to slip our eyesight. As the years roll by, those road signs get a little fuzzier, and the fine print on your prescription bottle might as well be hieroglyphics. Routine eye exams, glasses, and contact lenses. Medicare says, sorry, not my department. Now, think about that for a second. A decent pair of glasses can run you $200 or more, and that's before you factor in the exam another $100 or so. For seniors on a fixed income, that's not pocket change. It's a choice between seeing clearly and paying the electric bill. Medicare will toss you a bone after cataract surgery, one pair of glasses or contacts. But for everyday vision needs, you're flying solo. This isn't just about numbers on a bill. Good vision is freedom. It's driving to the diner for a slice of pie, reading the Sunday paper, or spotting a cardinal in the backyard. When Medicare skips out on this, it's not just leaving a financial gap, it's dimming a piece of your independence. How many seniors are squinting through life because they can't swing the cost? Too many, that's for sure. What's the move? Medicare Advantage plans, Part C, often throw in vision benefits, definitely worth a look. Or check out local programs like Lions Clubs, which sometimes offer free or discounted eye care. Don't let your world go blurry over a coverage gap. Number 2, hearing aids. Next up, hearing. Ever notice how the TV gets louder as the years go by? Or how you're asking, what did you say more often? Hearing loss sneaks up on us, and it's a big deal. Yet Medicare doesn't cover hearing aids or the exams to fit them. These little devices aren't cheap. We're talking $1,000 to $4,000 per ear, depending on the bells and whistles. For a lot of folks, that's a year's worth of groceries. And it's not just about hearing the birds chirp, it's about staying connected. Missing out on conversations at the Thanksgiving table or your grandkids' school play. That's a gut punch. Studies even link hearing loss to loneliness and dementia. So why's Medicare sitting this one out? It's a head-scratcher, and it leaves seniors in a tough spot. Picture this, you're at a family reunion, smiling and nodding, but you're only catching half the story. That's not just inconvenient, it's isolating. What can you do? Some Medicare Advantage plans cover hearing aids, so shop around. Groups like the Hearing Loss Association of America also point you toward affordable options. Don't let the quiet take over. Number 3, dental care. All right, let's talk teeth. You might not think about them much until a filling falls out or a toothache hits. But dental care's a biggie, and Medicare doesn't touch it. No routine checkups, cleanings, fillings, or dentures. Nada. This one's a double whammy. First, there's the cost. A basic cleaning can be $100, and don't even get me started on crowns or implants, thousands of dollars. Easy. Second, it's not just about looks. Bad teeth can mess with your whole body. Heart disease, diabetes, you name it. For seniors who can't chew right without dentures, malnutrition's a real risk. Think about that elderly neighbor who skips the dentist because their social security check won't stretch. Next thing you know, they're in the ER with an abscess. Medicare might step in for something tied to a covered procedure like fixing your jaw after a car wreck. But for the everyday stuff, you're out of luck. Options. Medicare Advantage often includes dental, or you could snag standalone dental insurance. Some clinics offer sliding scale fees, too. Your smile's worth fighting for. Number 4, routine foot care. Our feet take a beating over the years. And as we age, they need TLC, especially if you've got diabetes or arthritis. But Medicare's like routine foot care. Not my problem. That means no coverage for trimming toenails, tackling calluses, or other basics unless it's medically urgent. For most, this sounds minor until it's not. Ever try cutting your own toenails when you can't bend over like you used to? Or picture a diabetic senior ignoring a callus that turns into an ulcer? Suddenly, it's not just a pedicure, it's a hospital stay. Feet keep us moving, keep us independent. When Medicare skips this, it's betting you won't notice until it's too late. What's the play? If you've got a condition like diabetes, Medicare might cover necessary foot care. Otherwise, Medicare Advantage or a local podiatry clinic could save the day. Keep those feet happy. Number 5, cosmetic surgery. Cosmetic surgery's tricky. Medicare covers it only if it's medically necessary, like rebuilding your face after a crash or fixing a birth defect. Want a facelift to turn back the clock? That's on you. But here's where it gets real. What about a breast cancer survivor needing reconstruction after a mastectomy? That's not vanity, that's healing. Medicare's got your back there. But the line between cosmetic and essential can feel like a tightrope. Appearance matters more than we admit. It's not about Hollywood glamour. It's about feeling like yourself again. When Medicare draws that line, it's asking you to prove your need, and that can sting. What to do if it's medically justified? Work with your doc to make the case. Otherwise, financing or charities like the American Cancer Society might help. It's your body, your rules. Number 6, acupuncture. Acupuncture's been around forever, sticking needles in all the right places to ease pain. It's big in the US now, but Medicare's coverage is stingy only for chronic low back pain since 2020, and that's it. Sessions can cost $75 to $150 a pop, and for folks swearing by it for arthritis or migraines, that adds up fast. It's a clash of world's ancient medicine versus modern bureaucracy. Medicare wants hard data, but patients just want relief. Ever wonder why we're slow to embrace what works for so many? This gap feels like a missed chance to blend the best of both worlds. Options. If your back's the issue, see if you qualify. Some Medicare Advantage plans cover more, or look for community acupuncture on the cheap. Pain doesn't wait for policy. Number 7, long-term care. Here's the elephant in the room. Long-term care, nursing homes, assisted living, in-home aids, Medicare doesn't cover it if it's just help with daily life. The price tag, brutal. Nursing homes can hit $100,000 a year, and even home care's no picnic. Most folks can't foot that bill, so they burn through savings to hit Medicaid's cutoff. Medicare covers short-term skilled nursing after a hospital stay. But the ongoing stuff? Nope. This is America's retirement reality check. We're living longer, but the system's not keeping up. Families are left scrambling, and it's a conversation we dodge until it's staring us down. What now? Long-term care insurance is an option, but it's pricey. Veterans benefits or a reverse mortgage might work. 2. Start planning yesterday. Number 8. Care outside the U.S.? Love hitting the road in retirement? Watch out, Medicare doesn't travel. Get sick in Italy or Mexico, and you're paying cash. There's a tiny loophole like care on a US-bound cruise, but for most globe-trotting, you're exposed. A broken hip in London could bankrupt you. It's a harsh wake-up call for the wanderlust crowd. Travel's a rite of passage, a bucket list must. Medicare's America-only vibe feels like a buzzkill. Fix it, get travel insurance with medical coverage. Some Medicare Advantage plans help abroad, too. Don't let a dream trip turn into a nightmare. Number 9. Outpatient prescription drugs. Medicare Parts A and B skip outpatient meds, crazy. Right. For seniors popping pills daily, that's a budget buster. Part D fixes this, but you've got to sign up, and there's still copays. Miss the deadline, and penalties pile on. Drugs keep us ticking. So why's this an extra step? It's a reminder healthcare's a puzzle, and you've got to piece it together yourself. What's the deal? Get on Part D or a Medicare Advantage plan with drug coverage. Ask about generics or assistance programs. 2. Pills shouldn't break the bank. Number 10. Routine physical exams. Last one, routine physicals. You know, the full once-over to make sure everything's humming. Medicare says no, though you get an annual wellness visit to chat history and prevention. It's a head-scratcher. Catching problems early saves lives, but Medicare's playing catch-up instead. What to do? Use that wellness visit, and if you want the works, pony up or check supplemental plans. Prevention's your ace in the hole. Wrapping it up, your health, your fight. Medicare's a lifeline, but it's got holes you could drive a truck through, from vision to long-term care. These gaps aren't just paperwork, they're personal. They hit your health, your savings, your life. The good news, you've got options. Medicare Advantage, Medigap, community resources. There's a way to plug the leaks. Talk to your doc, your family, your insurance guy. Get ahead of it. This is about more than coverage. It's about thriving, not just surviving. What's your take? Ever hit one of these gaps? Let's keep the convo going. Thanks for hanging out with us through this Medicare deep dive. Did it open your eyes? If you liked it, smash that like button, subscribe, and ring the bell. We've got more coming your way. And one last thing, tell us where you're from in the comments. Are you in sunny Florida, snowy Minnesota, or somewhere in between? Your support keeps us rolling. Stay smart, stay healthy, and we'll catch you next time.